This presentation highlights the benefit of utilizing an electronic health record. Here is a brief outline of what I will be discussing today. Some definitions, the clinical and quality benefits of the EHR, some financial benefits of using an EHR. I will also briefly discuss health information exchanges and the benefits they bring to the healthcare system. And finally, I will point out some potential problems with EHR use. So to start, just what is an electronic health record? Well, the electronic health record, or EHR, is a longitudinal electronic record of patient health information generated by one or more encounters in any care delivery setting. Included in this information are patient demographics, progress notes, problems, medications, vital signs, past medical history, immunizations, laboratory data, and radiological reports. The next definition is meaningful use. HealthIT.gov defines meaningful use as using the EHR in a meaningful way that allows for the improvement of quality, safety, and efficiency in healthcare, improves the coordination of care, and engages patients in their own care, all while maintaining security and patient privacy. Next up is the Health Information Exchange, or HIE. This is a platform that allows patients, individual providers, and healthcare facilities the ability to securely transfer or share important medical information. This sharing can contribute to the increased quality, safety, and satisfaction of patient care, as well as decreased costs for both patients and healthcare providers and facilities. Another definition that we need to know is computerized physician or provider order entry, or CPOE. This is simply the process of capturing a physician's instructions for patient's care electronically to improve the efficiency of care delivery. And for our final definition, clinical decision support, or CDS. This is an electronic process which aids in clinical decision-making using characteristics of the patient to generate specific assessments or recommendations in order to improve patient care. Now that we are all clear on the definitions, I can discuss some of the benefits of a good EHR. The first is that it improves access to data. Having a central source of this data aids in the diagnosis of diseases by providing a comprehensive picture of the clinical scenario. It also helps to prevent medical errors and improves patient outcomes. One 2012 study reported that 75% of doctors surveyed stated that the EHR allowed them to provide better care for their patients. Another benefit is that there is improved reporting ability. Having data entered either by interface biomedical devices or at the point of care into a central database allows for easier extraction of data. This data can then be used to support quality and safety initiatives. Data can also be reported or uploaded to various governing or reporting agencies. Next are the clinical decision support systems. These help to prevent medical errors and provide physician tools that improve care. Some of these tools are alerts and reminders, which provide a visual cue to providers regarding drug-drug or drug allergy interactions, critical lab values, a needed test or medication based on the patient diagnosis or a worsening in the patient condition. Care sets allow providers to utilize the most recent evidence-based orders for a patient with a certain diagnosis. Drug dose calculations automatically calculate weight-based medications based on the patient's current weight, and then info buttons which allow the provider access to additional information regarding the disease process, a medication, or any other clinical information at the touch of a button. Another way that EHRs are beneficial is that they increase patient safety. One way they do this is by preventing medication errors. A 2012 study of Pennsylvania hospitals reported a 30% reduction in all medication errors. Another way that patient safety is increased is through built-in alerts that let providers know of potential complications or a worsening in the patient's condition. Also, the use of CPOE allows for the correct interpretation of physician orders. Another benefit seen from EHR use is that they increase patient involvement. When patients are engaged in their own care, it can lead to a better patient outcome and can increase patient satisfaction in their own care. One way to accomplish this is through the use of a patient portal. A patient portal gives patients access to certain parts of their medical records, such as lab work, a diagnosis, or discharge instructions, and can help keep the patient engaged and partners in their own care. Next, I'll discuss some of the financial benefits a hospital can receive from the use of an EHR. The first being that it improves efficiency and productivity. The avoidance of duplicate tests saves the facility money, and the ability to have test results in real time saves time for providers. Ease and access of the entire patient record means the record can be accessed from anywhere at any time. They also reduce the amount of time doing paperwork. Also, the ability to utilize automated charge capture. Not only does this save time, but it increases charge capture, which can result in increased revenue. Government incentive program versus penalties. Healthcare facilities using an EHR and demonstrating meaningful use are eligible for financial incentives from the Centers of Medicaid and Medicare Services. On the other side of that coin is that Medicaid and Medicare eligible facilities will incur penalties beginning in 2015 for a failure to show meaningful use. Next is the Health Information Exchange. These allow for health data to follow the patient through the continuum of care and can thereby reduce cost for healthcare facilities and for patients by decreasing the amount of redundant tests and procedures. They can also increase quality and efficiency by granting providers and facilities access to the entire patient record. So, what are some potential problems with EHRs? Well, one of the biggest is that the initial cost may seem prohibitive. Not only does the healthcare facility have to budget for the initial software, but other costs including additional hardware, training for staff, and IT support. Another problem is that you may get stuck with a poorly designed system. Flaws in the system could end up harming numerous patients. Data could be missing or corrupt. A poorly designed interface could delay patient results. And then there are the system downtimes which cause delays in treatment and could potentially cause poor patient outcomes. Next, an EHR could have poor usability or be used improperly. Poor functionality. A good system should be user-friendly and intuitive to use. Data entry errors. Data delivered by the system is only as good as the data entered into the system. One new type of error that is being seen since the advent of the EHR is called an adjacency error. This is where a provider selects an item next to the intended one in a drop-down menu, such as the wrong patient or medication. Improper use of functions. Some examples of these are improper use of cut and paste. This can lead to charting errors, and the use of templates. Templates often fill in data for the provider, which can lead into charting before an event has even occurred. Finally, the final problem to be discussed is alert fatigue. As with alarm fatigue, too many alerts can cause the provider to miss a potentially critical result or interaction. Thank you for your time. Are there any questions?